So as a doctor, I never expected to have to come and advocate like this. I provide medical care, I do surgeries, but I feel right now this is just as important because we're not able to provide that medical care without the support that is needed here. So I feel that I'm continuing the mission by going to the White House, going to Congress.
I want to carry a message of our colleagues there in Gaza. We had established a good connection with the ICU physicians, intensive care physicians and nurses, and we want to carry their message to our government here. We want to protect these people because they don't feel safe. They feel fear inside them, especially with the escalation that happened lately, that the hospital, the European hospital we work at, is going to be getting invaded and they will get killed.
Going there, I just thought that I'd be able to help the best I can, offer what support I could, but coming back is what I didn't quite realize would have such an effect on me. These relationships we built, the injustices that I saw, all the children that were dying, the families that were gone, and I feel that I can't sit back and not share this stuff. It's anything from basic equipment. You walk in, the first thing you're supposed to do is wash your hands before you touch a patient. We didn't have soap, we didn't have paper towels, no hand sanitizer, so you're already potentially hurting and harming your patient by assessing them without clean hands.
There's no reason, there's no reason whatever to not allow medical missions and not allow supplies to go in. We are against killing of civilians anytime, anywhere, from any side. And then the solution is not like by escalating more and killing more civilians, especially majority of the civilians are women and young children. This is so heartbreaking, and now they are choking the health system so nobody can survive. For example, we have that kid who's 70 to 80% burn, and then he's only 7 years old. On the top of this, he was on the ventilator. He had severe dehydration. It took a time until he reached us. We couldn't save him. We come to the point after a couple of days, we are running out of supplies to do a dressing for that kid. And then we decided we probably should divert our resources to some other patients that they have a higher chance of surviving. So it breaks your heart when you make a decision like this, prioritizing some patient life over others, because some of them are hopeless, and then you want your resources to be saved for a patient that you have some hope with.
The level of civilian casualties that I experienced was beyond anything I'd seen before. I had not experienced the number of children that I was seeing in this case. The number of burns were much higher than what I've seen in the past. Families that were coming in, I saw very few combatants or possible combatants in this, and that's not what I'd experienced in war in the past.